I'm going to be beginning with straight cath because I passed indwelling catheter during proficiency. It is essentially the same as a pulley catheter, except it is short and sweet, so you're going to be entering it and then removing it as soon as you drain the urine from the bladder. So you'll provide privacy for your patient. You'll have a waterproof pad below them. You'll have your sterile field set up. You'll have them supine with their knees bent and their legs apart. You're going to first wash them off with mouth soap and water, and then you'll get your iodine cleansing sticks, and you will hold their genital area and you will cleanse them that way. Then you will hold that position and take your lubed catheter and you're going to insert it. And I would have a receptacle down below the catheter to catch the urine when it drains. And once it drains, that's it. That's the catheter. And you can do it up to 3 times before you have to insert a pulley catheter. And the purpose of that is to reduce the risk of infection. You could also do a straight cath if a patient was going into surgery and they needed to drain the bladder before the procedure took place. To irrigate a catheter, you're going to first perform hand hygiene, get your gloves on, and then you're going to alcohol off the needleless access device, which is right here. So you alcohol that off. Then you would get your syringe with your 5 to 30 milliliters of saline or whatever prescribed amount. And then you're going to insert that. You're going to push it in, and then you're going to track the water. And then once that's done, you'll get another alcohol wipe and you will alcohol off. And that's irrigating. Now we're talking about the leg bag, which is essentially the same as a pulley bag, except it's a smaller version, and it's strapped to the patient's leg, and this is more discreet, and it also allows them to move around freely. To empty the bag, you're going to pull this out. You're going to have a little specimen container below it, then you're going to unclamp it this way. You can have it run off into the container. You can take a specimen from the catheter or from the bag if it's just been placed. Otherwise, if it's been in the patient for an extended period of time, you would need to clamp off the catheter at the top and then wait 15 to 30 minutes before you take one, and you can take it from the bag through the needleless access device here. To perform cath care, which you do every shift or as needed, you're going to take mild soap and water and a washcloth, and you're going to wash around the genitals, down the catheter. And then to remove the catheter, you're going to get a towel or a washcloth. You're going to have the patient take a deep breath, and as they exhale, you're going to pull it out and wrap it up in the towel or washcloth and discard.